Have you had an opportunity to go practice pediatrics outside of the country? You've studied outside of the country. I'm sure you have networks, and your counterparts are most probably making it, seemingly making it better than you here in Kenya. Why are you still here?
It's actually something that I have really been trying to do.
Okay.
One of them was to head off to the UK. But for me, initially it was to go and work.
Yeah.
But now I'm looking at it different. Now it's more of me being a global pediatrician, if you may.
Okay.
Increase my exposure, my experience. Learn pediatrics in the Western world.
Yeah.
The way it's supposed to be. Yeah? Not just to be stuck here, treat malaria, diarrhea, and things like that.
Yeah.
But also broaden myself, increase my knowledge as a pediatrician, hopefully go for fellowship, but with the aims of getting the knowledge and coming back
Yeah.
as now and give it back to the people. I was for it, but I'm no longer for it because now I'm a family man. There's a lot of dynamics that I have to think about,
Yes.
Relocating and things like that, quality of life. If the dynamics do change, then sure. But globally, we have a problem. Right now, health-wise, in the UK, we have strikes now going on. It's never heard of. In the US, we have strikes. So right now, actually going there is not really, for me, it's like I'm just going to be the plug to some shimo that is
Right.
happening in the healthcare system in NHS and in the US.
So it's not necessarily heaven, but I hear many people say they're trained for something else here in Kenya. They get, an entry point to the US. Let's say, for example, they take up nursing because it's a, high demand kind of profession.
It's because of the systems of education. So if you
Okay.
go to the US right now, even me as a pediatrician, I won't be able to enter. I'll probably go into nursing or
Okay.
some other stuff, or I'll have to sit for what they call the medical licensing exams and take myself back to medical officer level. But still, they don't. It's a different system
Okay.
from how we train here.
So it's easier for you to plug to UK because, of course.
UK,
All right.
Australia, Canada, if you're a doctor. But for the nurses,
Yeah.
now for the nurses, it's very easy. So we have a
Okay.
lot of nurses going to the US, some going to the UK, but a lot of them are preferring the US because there's a shortage there and the pay is good.
Right.
I have friends that I worked with who are nurses. They're doing amazing
Yeah.
over there. They're sorting out their families. They're building houses now because nurses work. I mean, they're getting paid more than a pediatrician or as a specialist as a nurse, so they can do much more.
Do you see that and regret the route you took sometimes? Are there any regrets?
No, I don't think I have any regrets in terms of health. I wish I was more aware.
Okay.
Because I was in the same boat of assuming that, once you become a doctor, it's good life. I didn't expect the journey to be this long.
Yeah.
I wish somebody would have broken it down to me that it takes time. When you see that doctor with that V8, it took that person a lot of time. So it's one of those things where even artists, you see an artist and you're like, oh, then there's a new guy,
Yes.
Or how the world would see Burna Boy and say Burna Boy is the new artist, and he came to them. Burna Boy is someone they heard 3 years ago probably.
Right.
But you don't see the journey of Burna Boy from when he started and things like that. So it's the same thing. You see the big car, but you don't see the years.
The process it took.
Yeah, it took.
And you mentioned now music. It's funny, you did share this on another platform that you were making much more money as a rapper with your music in Russia, of all places, than you would be making in the medical fraternity. Why did you come back? Do you have more love for the medical field than rapping, the music?
Not really. I came back because I felt like, okay, let me do my internship back here. I'm
Okay.
a doctor. I need to think long term.
Okay.
Also because I sat down with a lot of artists there, well-recognized artists, and most of them would tell me, like, the music is cool, keep doing the music, but being a doctor is more special.
Got you.
It's more impactful. If you want to continue the music, don't stop. You can do it,
Right.
but don't stop medicine where you are now, because I've had many moments in my final years of medicine where I wanted to quit because it wasn't making sense.
Yeah.
Back in those days, before the main strike, before the doctors' union, doctors used to earn $400
Yeah.
a month or so.
Okay.
So, I mean, I was like, okay, $400, man, I'd make 600, 800 a weekend
Yeah.
just being an MC, you know, not even singing my own songs. I was like, okay, fine, something has to give.
Right.
But I came because my family was here.
Yes.
My mom at the time, her health was not too good. So that's the main reason I came back.
Yeah. So you wouldn't, if you rewound, go back to
No.
those years, you'd still do medicine.
I wouldn't go back because even medicine in Russia is also a very, you know, it's the country of communism,
Yeah.
socialism, and things like that. So even doctors, they don't earn much.
Right.
Yeah.
No, in the sense you're training for medicine, you'd still pursue it, knowing what you know now.
Yeah,
struggle.
I'd still pursue the sciences. When I was a teenager, I knew I just needed to do sciences.
Right. What about music? Where's that now for you?
Music. I have. Hey, Kenya traumatized me when I came back. I had this. I think I had very high expectations.
Yes.
Or maybe I wasn't being smart enough because my assumption was, you know, I've been doing the music in another country. If I just now start to transition, things would pick up
Automatically,
and
yeah.
things like that. And then I slowly discovered Kenya, corruption, lack of systems in place, how artists don't get paid.
Yeah.
One of the things when I did come back, when I was asking a lot about, was things like publishing, songwriter, copyrights, masters. Those are the questions I was asking. And I think even today, if you ask those questions, a lot of people will be blank in telling
Right.
you how they make money off of it. So when I saw the lack of systems, I realized that most artists, it's mainly through gigging that they get that.
And
But
endorsements now picking up.
yeah, now you see the music has changed. The trajectory of music now, of the music artist, even how you promote your music is different. It's all about social media. It's all about
Yeah.
TikTok.
Yeah.
The right type of dances and things like that. Back in the days, you used to have gatekeepers. Yeah, guys on there was no
The
YouTube.
radio hosts and all were the ones.
Yeah, it was NTV. It was
DJs.
The Beat.
Yeah.
If you haven't impressed Pinye with your video, Pole, go back. And you could have invested a lot of money on a video,
Yeah.
and somebody just tells you, boss,
Doesn't cut it.
this one, I'm not even feeling it. The video quality is good, but I'm not feeling it.
So having, you know, seen that, but you see people are making it right now, would you say there's a take two for you, or you're done with it?
For me, music will never stop. I think for me now, I'm doing it in a more, now that I've gotten back to it. I took a break from music because of my master's for 3-4 years. I didn't make any new music.
All right.
But now that I've gotten back into it, music is still calling me. So now I'm doing it not, I don't need to do music to survive.
Right.
If you get what I mean. I'm not saying that music won't be a nice avenue of revenue. And if that happens, good. But I'm in a space where I'm doing it for me.
Okay.
I have a son now. So I feel like there's a lot I have to say that is not on social media, typing on Twitter or doing an Instagram video. There's still a lot of impactful ways I can do it through the music.
Right.
But in a way that everything that I'm doing now, I'm more self-conscious of. If my son listens to this 10 years down the line,
All right.
what will he, look at? Because when I look at the young me of music, it's a lot of braggadocious, it's a lot of this and that, and anyone can play with words and
Yes.
and have catchy hooks and things like that. But when you're gone, for me, I look at music as immortality. Like this stuff lives forever. So if you're going to do something that is going to be on record forever, what are you saying that is different from others? So that's where I am.
Right.
I'm back to the, I was on the training wheel bike this year. I've set up, I have my own studio. I'm recording, I'm learning how to engineer.
Wow.
I'm learning how to.
Where'd you get the time?
So that's the thing, I create it. You have to create the time. You have to create the time. because I also realized being creative also helps with my mental health.
Got you.
Because I've dealt with the PTSD, I've dealt with a lot of anxiety. My mental health took a lot of, it took a toll.
Yes.
But the more I was creative, when I create music, even if that stuff you're not going to hear it or whatever,
Yeah.
but when I create something and I like it, and I vibe with it, or I play it, and my son is in somewhere running around and he's listening to it and he's jumping up and down, that already gives me joy. It's a form of therapy.
And it's interesting you say that, and we're wrapping up now because the creative space, I'm in a different space right now, having left the mainstream media through a redundancy in November. And I've had such an opportunity to explore the gifts and the talents. I used to rap as well, and Dana said it was actually my producer. He did our
Wow.
first track. Yeah, but you'll never hear it. You will never hear it. But he has it somewhere. I'm paying him good money to keep it there and never release it. But it's a passion. Music is a passion. But something else I've gotten into is acting, because it's a creative space as well.
Yeah.
And it just allows you to live something in a different space and imagine something new, right? And even this is creation in itself.
Yeah.
And yes, if you don't put money in front, you'll be able to do it because it gives me a fulfillment. And with that, of course, I know there's some magic that happens with it. So can we expect...
Not just magic, it's actually science. So if you look at it and if you do your research, what I came to discover is that when you submerge yourself in the creative arts, whether you're a painter,
Yeah.
whether you're a dancer, whether you're an actor, musical artist, studies have shown that actually being in that space is just the same way you can have therapy,
Yeah.
whether it's medical therapy, whether it's psychotherapy, whether it's meditation and breathing exercises, things like the creative arts
Yeah.
has more and more research is showing just how important it is for your brain, just to make sure that you balance out the chemicals that usually give you anxiety,
Right.
depression, and all that other stuff.
And that's something we need to be keen on right now. And I was going to ask you, and you've answered it already, how you balance being a father, being a husband, being a rapper, being a pediatrician, an activist for the same cause, all those things, and still maintain your cool. So creative spaces is a balance for you.
Yeah, it's a balance, but I'd say a support system.
Support system.
My support system is great. I mean, I was all those things before I was a dad.
Yeah.
But then I became a husband, and then I became a father. So in terms of the household, even like I really don't have to worry about my son because my wife has really gotten into motherhood. So that support helps.
Right.
I don't see him as much because I'm grinding, doing other things, and for a while it used to really bother me. But I realized when you come home and you see how he's thriving in that space with the mom and things like that, it even gives you more fire to want to do even more stuff and start seeing, okay, fine.
Yeah.
Let's turn up on this creative thing that seems to be doing extremely well.
Yeah.
Let's start focusing on private practice, building the private practice so that the young king also has, a better childhood and whatever than I had. So yeah.
And
Support.
probably give him a sister or something.
Man, the way my account is set up right now, he can't get a sister. But yeah.
But there's something about, about that. People say you need to bust the myth about, you need a large bank account or, balance to be able to get another child. Yes, you have to plan. But sometimes someone told me, and this is someone who has 3 kids, I have 2 right now, that we over-imagine what it takes to have, to be able to have another child. And we imagine that we need millions or something. But if you have the right structures in place, like a child really needs not that much to just be alive. And you're a pediatrician anyway. Hata kigonjeka suta mtreat tu yani.
Daktari hajigangi. So I try to avoid that. I try to avoid that.
So you like your son right now.
Yeah.
1.5. But I say kigonjeka suna mtreat tu.
Yeah, that's definitely a plus.
Yeah.
Sometimes I also overreact. So I find myself calling a lot of my colleagues who are pediatricians because you're in panic mode. That's why you don't treat your family, because the emotional attachment can actually you might be a really good pediatrician, but when it's your kid, I mean, it's just something else.
So
The
that's true.
emotion is different, seeing
Right.
them sick and things like that. I think that also has helped me be a better pediatrician because now I can relate and empathize more
Right.
with moms, with dads. I kind of understand the anxiety of seeing their child sick, vomiting, and things like that.
Yeah.
But yeah, man, it's a great thing. Like you're saying, I do believe that if you can't manage with one, or if you can't manage your finances with what you have now,
Yeah.
then even if you get 10 million, you still won't be able to manage. So
That's
you need
right.
to be able to manage with the little that you have. So yeah, I guess, but wait until I pay my first school fees, or is
Yeah.
it playgroup? We'll see how that goes.
Mtafika hivi karibuni. And this is another sneaky attempt to get an answer. So you say you're bringing out new stuff in terms of from the studio. How soon?
No, I'm not going to do that.
Oh.
I'm not putting any timeline right now.
Oh.
I'm just in a happy space. I can tell
Okay.
you for sure that there's definitely some amazing stuff I've recorded.
Yeah.
And I think it's good. How I'm going to put it out, when I'm going to put it out,
It's up to you.
I really don't. I don't have like a press play type of thing. I believe in like making timeless music. So if I drop it today, drop it tomorrow,
Yeah.
drop it next year, it should still make kind of some sense. So not going to put a timeline, but definitely you're going to see more of me in the music side.
Can I ask a sneaky question? Your wife, beautiful voice. Can we expect something? She working on something?
Oh, no, that one you'd have to ask her.
Ah,
that one you'd have to ask her. Dan can call her and ask her.
Dan can call her and ask
They
her.
know each other from
I was
from
really
way back.
hoping you'd say that, but
Aneza muuliza.
I hope it's not the last of what we've heard because she has such a beautiful voice. Shout out to you, Della, and thank you for allowing him to come through for this interview. Najua labda ilikuwa duty yake ya kuchange diapers size, but I really appreciate.
She's at home.
Yeah.
We're not with my nanny today, so she's
Thank
holding.
you.
That's the support system. So that's what enables me to come for an interview.
Yes.
To go and see some patients.
Yes.
To go make some extra money here and there.
Right.
Because she's holding down the fort.
All right. So what are we expecting from you? Ask Dr. Rain. Are you putting something up officially from your practice? Where can people find you? And as you answer that, as you put yourself out on the social space, do you find that translates to patients physically? Have people located you through your socials?
A lot. A lot
Nice.
of my private practice now is growing.
Nice.
And a lot of it is based on the exposure on social media.
Yeah.
And talking about more pediatric things.
Yes.
So a lot of I like to think I'm a doctor that explains. I like someone leaving knowing that they know what the child has. It's not just go and do what I've told you, and your child will be better.
Got you.
So basically, I have if you want to see me, I do private practice at Mirazi, which is a multi-speciality clinic at 40 Suites, which is Hospital Road, just near Kenyatta, around that area, Nairobi traffic. We're based on the 8th floor, so karibuni sana. If you have my Instagram or all my social media platforms, the office line is there, so you just call. You can book a consultation with me. It's on booking basis. I only do appointments. I don't do walk-ins and keeping patients there the whole day. So I tell you today, I have so many things to deal with. I don't want to keep you there. Come on this day at this time with your child, and we should be able to sort you out.
Got you.
And definitely now I want to ask Dr. Rain, like I said, the plan is to turn it a notch higher.
Yeah.
I want to move away from just being on TikTok and whatever. I want to have a proper platform. I want to get into the podcast space as well with Ask Dr. Rain, so that I can invite more people who have more knowledge than I do, who can break things down. People, my colleagues, my field, I have so many people, most of the doctors you listen to are boring, and it's like they're preaching and you want to fall asleep.
And talking down on you.
And talking down on you. You want to bring people that are relatable, so that when you say things like, I got COVID and I feel like, I was this mom, you're in a safe space, yeah?
Yeah.
Name whatever. Or it's like one of those things of, hey, doc, mazee niko na hii antibiotic, lakini leo kuna office after party, neza kunywa, like reality.
Yes.
It doesn't always have to be sinister. The whole thing is holistic, health-wise, on a level that people can understand, and that we're also giving you healthy choices.
Let me ask you one I've always wanted to ask, and I know it's not your area of specialty, but you probably looked into it, because we hear the same hairstyle. We wear the same hairstyle, beg your pardon. Inatoka kwa buda ama kwa mother? Hii kipara.
It's different things. It's different things. So
All
one
right.
genetic, yes,
Okay.
mostly it's Buddha side. The other thing is that there's so many factors, especially with the environment. So the endocrine system and what we're exposed to, our testosterone levels. There's so many things from plastics and things like that. It's not what they say on. There's this guy on Twitter. This doctor is called Amerix. That says that bald people, it's usually a fapping problem, and they need semen retention to regain their hair. All that is just jabba. My stories are jabba. So like, yeah, and those are the things that I
Yeah.
talk about that people feel they can't really ask and things like that.
Yeah.
So it's
And we
but
should talk
it's,
about it.
It's different things, man.
Well, I certainly hope my son doesn't take after me. My wife has beautiful hair, so tunaomba Mungu achukue hiyo side.
Yeah.
Iwapo.
Well, I had a lot of hair as well. My son really has a lot of hair, but yeah.
Let's hope it stays there, man.
Let him enjoy it.
Dr. Rain, I really appreciate your time here on the Social Newsroom. I'll end with something that you have tweeted and that you, I think, look at as a mantra in many ways. And you say, this is a quote that you tweeted on, and quote for the day, how long are you going to wait before you demand the best for yourself? Epictetus, I believe is the name.
Yeah.
This life is a marathon, Dr. Rain says. Keep doing sprints and you will burn out before the finish line. It moves at a fast pace, but we're too busy looking ahead that we miss it in the present. Embrace the journey. That's a great quote, man.
Yeah.
Great quote. Asante
When you have kids, you realize how fast life moves.
They change. They just change, and like you blink, something else has happened. They're learning to talk. They're running. So yeah, looking forward to album ya pili kwa nyumbani huko. Mtoto wa pili yani. Utatueleza.
No, definitely more music on the way.
Tell them on that camera over there. There's more music on the way. That one up there.
More music on the way. I'm not giving any timelines. I don't want that stress of social media.
Smart.
Don't expect any dances from me. I don't dance. You might expect maybe freestyle challenges. Drop a couple of beats for you guys, and you can do challenges. But yeah.
You know what they say? Gangsters don't dance. They boogie.
No, I don't. I got 2 left feet, man. I hope my son gets it from his mom. The mom
man. And really, actually, your mom, if you'll allow, she could probably come and tell us her story, how things have been and how she's, what she's planning for the future. This is an invitation. Trumze, utatuambia Dela kama unaweza kuja upate muda uje hapa tuongee at the Social Newsroom. I appreciate your time as well, those who've tuned in. We had a problem with our live stream earlier, the one that we had posted. And that's why I didn't refer to comments and yes. So right now, we call it, a show and say good night. Let's meet here again, same time, same place on the Social Newsroom. Labda itakuwa Dela, huwezi jua.